I am melting into the chair.
Hi, my name is Andrew, and I'm the Head and Director for the NUS Health and Wellbeing team.
Hi, I'm Kinjal. I'm the Lead Psychologist for the NUS Health and Wellbeing team.
So today we are here to debunk some of the myths pertaining to mental health conditions, and we're glad that you are here watching with us. So Kinjal, let's start off with the first myth, that people with mental health conditions are dangerous. What do you have to say about that?
Well, I think that's an unfortunate myth out there, Andrew. In fact, people with mental health conditions are more likely to be the victims of abuse and are a vulnerable population.
I'm glad that this myth is unfounded, as we do not need to be afraid of people with mental health conditions. So let's move on to the next myth, which is that people with mental health conditions are unproductive.
Well, though people who are struggling with mental health may find it harder to perform at work, they can definitely lead very productive lives if they have the right coping strategies and the necessary support.
That's because a lot of us may not understand mental health conditions enough. There's this prevailing myth that people with mental health conditions should be avoided.
I'm glad that you brought that up, Andrew, because I think that our concern of avoiding people with mental health conditions come from being uncomfortable or afraid of what to say or what to do or how they might respond and it affects us. Chances are that you're not likely to know that someone has a mental health condition very much like someone has a physical health condition unless you ask. In fact, more than avoiding them, we should go out and show our support and care to people with mental health conditions.
But some of us are kind of afraid of even initiating a conversation because they feel that talking about depression or anxiety just makes it worse.
I'm glad that you brought that up, Andrew, because that is not true. In fact, the evidence shows that actually by talking about depression and anxiety, we can actually reduce the stigma around these conditions and make people feel more welcome rather than isolated. So in fact, talking about depression and anxiety can be more helpful in helping them manage their difficulties.
So does that mean that after talking about it, people can just snap out of it?
Oh, I'm afraid that's not true. Mental health problems are just like physical health problems, and often it takes a lot of time before it becomes a real difficulty. So it's not just a matter of willpower and snapping out of it.
But when people go through therapy, they have this idea that therapy will not help me because it is about dragging up the past.
Therapy is really about being in the present and offering you practical tips and strategies on how to manage and cope in the present so that you can help also towards the future. However, we do bring up the past as sometimes we need to look back to see how we are doing, what we may need to change about the habits and the behaviors that we have so that we can not bring it into our present, and hopefully that will help us in the future.
There's this concern about money as well, that only rich people can afford to have therapy.
It is not true at all. There is a lot of affordable therapy options, both within NUS as well as outside NUS in the community. For example, in NUS, we have resources such like the Wellbeing Specialist Partners, we have the Employee Assistance Program, which is the NUS Heart, and all those services that are covered by the group medical insurance coverage, as well as many affordable mental health care options in the community.
If you'd like to know more about the health and wellbeing resources in NUS for you, do check out our NUS Health and Wellbeing Resources website. Thank you for watching this video. Have a safe and healthy day.